All right, chapter 25 for microbiology. We'll be looking at the circulatory and lymphatic systems. So for the anatomy of the circulatory system, we have our arteries and veins and capillaries. The blood travels through these, of course, and then it's pumped through our body, with the heart. So the thing that relates to microbiology is that our vessels are made of tissues that some bacteria can penetrate through, so they can move from tissues of infection into the bloodstream by migrating through them. Capillaries are very leaky, very thin vessels, so they are also a possibility for microbes to get into. Since our blood circulates through all of our body, once bacteria get into the circulatory system, it really has access anywhere in the body. And then we have the heart, which also can be susceptible to disease because blood runs through there. If it's carrying microorganisms, it can colonize the inside of the heart. It also colonizes the outside of the heart. And one thing about the heart, we'll mention endocarditis and pericarditis, which is the lining of the heart inside and lining all the interior of the heart and also the valves is something called endocardium. And then outside the heart, there's another connective tissue covering called the pericardium, and both of those can get infected. The lymphatic system is our immune system that we looked at, and the vessels, right, the lymphatic vessels that we have here are going to do two major jobs. One is to bring the excess fluid from our tissues back to the bloodstream, and also to filter that fluid. The fluid is actually called lymph. And it will filter that through various lymph nodes as it returns to the heart. So we can see on this diagram that we have vessels, and then we have these small little dots, right? Those would be the lymph nodes. And then the vessels all lead in one direction to the upper part of our chest here, where we have very large veins. And those veins are where the lymphatic fluids or lymph enter to recirculate into the bloodstream. So because the lymphatic system is going to basically pour right into the blood system, they are linked. And so the infections of the lymphatic system overlap a lot with the circulatory system. So one thing to understand about the lymphatic system, again, is just that it's a one-way tracking movement towards the heart. It goes into the venous circulation. Lymph nodes are these areas that are completely packed full of our white blood cells. So we have we have our non-specific, so we'll have macrophages, dendritic cells, antigen-presenting cells. We'll also have B cells and T cells inside the tissue. And we can see that the lymphatic vessels are coming alongside the blood vessels. So they're both going to be found within the lymph node. Here we just see a close-up of how our lymphatic capillaries and our blood capillaries are intertwined. And if we look at the arrows, the direction of the arrows, we have the blood coming in through the arteriole and then becoming our capillaries. The fluid from our bloodstream will actually enter into the tissues and cause the tissues to fill with blood. I mean, not fill with blood, sorry, it's the interstitial fluid. So the fluid will move out of the bloodstream and then also back into the bloodstream. But the extra fluid that stays in the tissues is moved out by the lymphatic system. So the lymphatic system is always present to remove excess fluid. The lymphatic system is also very leaky in terms of their cell membrane and connections. So really big cells or really sort of bigger microorganisms have an easier way to get into lymphatic vessels than they do into the bloodstream. The spleen is a lymphatic organ, and we'll talk about the spleen in a little bit, but it's going to have a couple roles. The first role it has is to be a lymphatic cleanser, right? So the blood comes into the spleen and it filters out items for the blood and also the lymph. I'm sorry, this is a lymph node, this is the spleen. So the spleen, the blood comes in, and then the spleen will filter the fluids that come in, the blood, and then capture basically, any of those microbes that might be in the blood. The second job of the spleen is to basically destroy and eliminate our red blood cells. So the spleen and the liver have that same job in common. When you have an extra amount of red blood cells dying, such as in malaria, those extra fragments of blood, they are going to overwhelm the spleen and also the liver, and they can cause the spleen and liver to basically have inflammation or disorder. This is the lymph node, and lymph is coming in. So you see how lymph comes in various inputs, right? We have these vessels leading the lymph in, but then lymph out is only going to be two. So here's lymph in, right? There's only two ways out or one way out, and so it causes the fluid in here to get backed up, and so it allows time for that lymphatic fluid to be within an area with all our white blood cells, so it increases the chance that any microbe in that lymph would be in contact with a white blood cell so that it can take care of it. Okay, so bacteria in the blood, we have lots of examples down here of different kinds of bacteria in blood. We can see rod-shaped, and I think this is a coccus. So the way we get bacteria in the blood is that some kind of breach of our skin or mucous membrane, right? So this can be anything, insect bites, wounds, toothbrushing, anything that causes bleeding, you can get a chance of bacteria in the blood. However, if you do get a little bit of bacteria in the blood, it's most of the time so little that your immune system can take care of it right away. So in most cases, the bacteremia results in transient and the levels remain low. However, the bacteremia can lead to sepsis if you had a huge a huge load infectious dose, or if you are immunocompromised or in some way unable to fight the infection. Bacteria can lead to septicemia. So the difference between the two is bacteremia is bacteria found in the blood, whereas septicemia is the bacteria actually multiplying in the blood. So they're using the blood as like a place to multiply. When we have bacteria basically multiplying and living in the blood, they will produce their toxins, and that can produce toxemia. We can have sepsis occur, which is the infection of the blood as a whole. And then we have septic shock, which of course is the drop in blood pressure that can lead to death. In a lot of these situations, when you have a huge reaction to an infection, such as septic shock, it is really, our immune system's response to the cytokines, the cytokines provided that cause our body to be overwhelmed in its reaction, and it can lead to those signs and symptoms of shock. So the immune system, we talked about super antigens before and cytokine storms before. So this is sort of the most probably dangerous part of sepsis or bacteremia. So another word on shock, I know you probably all know about this, but when you hear people with shock, right, it basically is a massive vasodilation, which is a widening of our blood vessels. And the junctions between our blood vessel cells are also a little bit open. And so it causes a lot of that fluid, right? We have leaky vessels and cause a lot of the fluid to come out. When you have a lot of fluid coming out of your bloodstream, it makes the blood thicker because blood is made of cells and also water. And so the blood becomes thicker, and also your blood pressure is going to begin to drop. And then if it drops below a certain level, then you're going to start to have organ damage because the blood is not going there to remove wastes and to provide oxygen. So you can have kidney damage, all kinds of organ damage, liver damage, respiratory functions can be damaged, and a condition known as septic shock, right? So septic shock is different from anaphylactic shock because septic shock is from infection, whereas anaphylactic shock was due to an immune response. So we talked about a cytokine storm, and this is what becomes of that cytokine storm. So the one shock we're going to talk about, a couple, is toxic shock syndrome, which is predominantly produced by Staphylococcus aureus, but also Streptococcus pyogenes can cause toxic shock syndrome. And the super antigen, or the toxin that does that for Staphylococcus aureus, is basically this toxic shock syndrome toxin 1, TSST1. And then the one for Streptococcus pyogenes is a streptococcal toxic-like toxic shock-like syndrome, excuse me, but it's a very similar toxin to the TSST1. So toxic shock syndrome can result from localized or systemic infections. So localized meaning just you have maybe a boil or a carbuncle, and it can result in a blood toxic shock, or systemic infections like pneumonia or osteomyelitis, which is a bone infection. Those at a higher risk for this is going to have some kind of pre-existing Staph aureus colonization of the vagina. And so this is that whole like tampon thing where like you should not leave a tampon in your vagina for too long because it can start to harbor growth of bacteria. Other things implicated are contraceptive sponges and diaphragms. So what does it look like? Vomiting, diarrhea, myalgia means muscle pain, a fever, and rapid onset hypotension. Hypotension is low blood pressure. You can get a diffuse erythematous rash. That means a very red rash, which you can see here. That can also lead to peeling and shedding of the skin. So you can see that kind of going on here too, some of the peeling happening here. And then you can also have organ damage. So those are the two bacteria and the toxins that can cause toxic shock. And then for osteomyelitis, so if you have a bloodborne infection, right, most commonly by Staph aureus, it can move into the bloodstream. It can move into the bone. Your bone is a well-vascularized tissue. It is not dead. It's living. Cells are there working all the time. And you can see that adults and children have different categories because bacteria, if they get into an adult, usually get into bone from some kind of trauma, like you have a broken leg, you break the bone, or some kind of surgical procedure where you're actually manipulating the bone, and you can sort of drive the bacteria into the bone. For children, it's different because it can arise basically from focal infections. So maybe they can have like I said, a carbuncle or a boil, or it can have impetigo. But if it does get into the bloodstream, then it more likely than not going to affect the longer bones in the body, long bones, because children are actively growing taller, and so those long bones are getting longer, and so they really have a very good blood supply. And so the blood supply to bones for children, is a lot more robust than it is for adults. And so in children, they're going to be most affected in those growing bones. Symptoms, fever, pain, swelling, and then you can lose the bone tissue, ulcers in the soft tissues near the site, and you can lose the bone. It can spread to the joints, of course. You can have some arthritis forming there, or it can just go back into the bloodstream and you can have sepsis or blood clots form. But these are just some nice pictures of osteomyelitis where you see the bacteria colonizing inside the bone. It's like within the bone tissue. And then this is a very startling normal x-ray of the tibia and fibula. And then you see what osteomyelitis has done to the tibia, completely shrunken. And you can see those spots where it's not white, those dark areas. That's going to be an area of softer tissue where the bone has lost its mineralization. And then interestingly, to sort of help out the tibia, the fibula here has gotten thicker in response to the loss of the tibial bone. The next one up is we have subacute endocarditis and pericarditis. So these are the two linings of the heart I talked about earlier. Many species can cause either, but we're going to talk about Staph aureus specifically, and then a viridans strep group. These are the streptococcus that are normally in our mouths. And this is where sometimes if you have gum disease, these bacteria can get into the bloodstream and then cause subacute endocarditis. So what happens is the bacteria will come into the heart because it's in the blood, and then settle on the valves. The valves have sort of like nooks and crannies that they can settle onto, and they can also cause blood clots. The clots are going to protect the bacteria, and then the growing clot with the bacteria are going to cause little patches to occur, and those are going to be called vegetations. So it's tissue-associated bacteria, and they mostly happen on valves. The valves can become fibrotic, which means that it is not as flexible anymore. It's very tough. And if you have a very tough, inflexible valve, it's not going to do its function, and you might need a valve replacement. So this is pretty serious. Pericardium or pericarditis is the outside of the heart. Again, Staphylococcus aureus, strep, and others. But this is less invasive. It's less serious. It can cause pain, but in most cases, pericarditis is self-limiting. The next one here is pretty serious, as you can see from the pictures. It's called gas gangrene, and it's caused by Clostridium perfringens. If you remember Clostridium, it is an anaerobic bacteria. There's several species that can cause gas gangrene, but this guy is a leader that causes it. And so let me ask, right, what causes the gas in gas gangrene? So remember, we have an anaerobe and we have fermentation happening, right? So if you have bacteria that are fermenting, products produced are acids and gases. So the gas from the bacteria is actually building up within your tissues, and it causes your skin to puff up and have these gas-filled chambers here. So with gas gangrene, it can remain localized, or it can spread very, very rapidly. The bacteria has all kinds of enzymes that can move through the tissues. It goes into the muscle, which is why it's also called myonecrosis. And here we see that word necrosis again, right? That means tissue death. So we're actually completely killing the tissue. There's no chance of regeneration. And the black you see here is a hallmark of that necrotic tissue. And if you look at the speed, right, the margin between necrotic and healthy tissue can advance several inches. I can't see that per hour. And even with antibiotic therapy, that's pretty scary. So when you see necrosis occur, it's a very serious condition, and you have to stop the movement of the bacteria immediately. So a lot of times they basically need to remove all the diseased tissue. If there's so much diseased tissues, sometimes they have to amputate. Septic shock can also occur from this. The mortality rate is greater than 50%. So it's a very serious infection. So the treatment, if these treatments don't seem to work as well, there's also, in severe cases, they put you in a hyperbaric oxygen therapy. How do you think this works to cure gas gangrene? Again, it's an anaerobe. Anaerobes are, oxygen is toxic to them. So if you put a patient in a higher than normal oxygen chamber, it helps to kill the bacteria. The next bacteria you have is Yersinia pestis. This guy causes the plague. The reservoir for the plague is in animals, so it's considered a zoonotic infection. It's primarily transmitted by a vector, the flea bites, or you can also handle the animals, the skins of animals, and inhaling droplets of animals. So there's 3 forms of the plague: bubonic plague, pneumonic plague, and septicemic plague. And you can see that the transmission is a little bit different for each. Bubonic plague is primarily transmitted by flea bites. Pneumonic plague is by inhaling droplets, as you would think. It goes into the lungs. And then septicemic plague can be a cut or some kind of immediate, direct into the bloodstream, or it can spread from pneumonic or bubonic plague. So the plague has a very big history to it. I'm sure you've heard of it, but I just want to point out there's been 2 really big plagues over the lifespan of humans. And so the first one, it was in the 6th century. You don't need to know that it originated in Africa or anything like that, but it did kill 5,000 people a day in just Constantinople, which is, imagine that happening now, that would be unheard of. And then where the plague got its moniker, the Black Death, was during the 14th century. And this is when trading became very robust between Asia and Europe. And so they think that the infection was brought over by this trade from Asia. And it basically decimated the population in Europe. 1/4 of the population in Europe died. And then 25 million have been killed in Asia and Africa by that same plague. That bacteria has cycled another 300 years in Europe, and it was called the Great Plague. So basically, it's been around in there, massively killed off a lot of people. And so you can see sort of the lineage, the lines of the trading routes here, and how quickly it sort of spread to all of Europe. This is a picture of the buboes, right? So an artist made images of the bubonic plague. So the bubonic plague would be hallmarked by these bumps, which are basically swollen lymph nodes. So look at the bubonic plague. Most of them are caused by flea bites. The flea bites, they mention in the textbook that is mostly going to bite your ankles and your legs, like the lower extremities. So the lymph nodes that are first affected are usually in the groin because the lymphatic fluid moves up towards the heart, moving through lymph nodes. And so when the bacteria enters a lymph node, it'll start to grow there. And when it grows there, the lymph node becomes infected and they're very, very swollen, as you can see. And so that's your bubo. The buboes are also necrotic, which is very dangerous, right? So you'll see that sometimes these buboes are black in images because of that necrosis. Mortality rate for bubonic plague is 55% if untreated, 10% even with treatment. Septicemic plague is where it enters into bloodstream and it proliferates around the body, releasing the virulence factors all over the body. And it's pretty fast. Patients develop a fever, chills, weakness, and then shock. Of course, shock means that your blood thickens, it coagulates, and when that happens, it blocks blood to different parts of your tissue, causing tissue death or necrosis, right? And so that black necrotic tissue is where Black Death comes from. And the septicemic plague is very quick. So a few days, and then you die. Even with antibiotic treatment, mortality rate is about 50%. So it's very, very severe illness. More commonly than not, it's the extremities that turn black, toes and fingers. You can see this patient here also with septicemic plague. And here's an image of the Black Death. And then there's a nice sort of reenactment video on Canvas that I recommend. It's only 3 minutes long, but it's pretty good. So lots and lots of people died. They didn't know what to do with them. They would have just big pits with people that were dying of the plague. Pneumonic plague is going to be from infected individuals, right? So you're going to breathe their aerosol droplets, and then the bacteria can get into the other person's lung. It's very, very contagious, and mortality rate is near 100% without treatment. You can die very, very swiftly. So this is all happening that when the Black Death was happening, this was still the time where people thought that it was that diseases were caused by like bad smelling, things like the miasma theory. They really had no idea what was causing this, which would be very, very scary if you were living that time and you just saw people dying left and right after a few days of becoming black, just tissues dying. This is in 1979, 2020. There are plagues still around, right? So the bacteria Yersinia pestis is still in its reservoirs. And you can see that these are the wild and domestic animals that we have Yersinia pestis in. So people who are close to these animals, campers, people who visit national parks, if you're around, a lot of these animals, it's going to raise your possibility to get the plague. So you can see that California is definitely a place where the plague is still active. Doctors of the plague. So you've probably seen this guy before, a drawing or maybe a representation of this doctor. So what this is how they would treat people. So the rationale for all of the covering, right? Gloves, shoes, long coat hat, all that stuff is to cover themselves. So the bad air, wouldn't contact their skin. The whole beak mask thing. So they had eye goggles basically, right? So they had coverings on their eyes. They had a long beak because the theory was at the time miasma. So the bad smell could cause you to get infected. So what they would do is stuff this with all kinds of aromatic herbs like mint and rosemary, just sweet smelling plant, herbs. And so that would filter the air as it came in, and they would be protected, they thought, from that. But the one area where they didn't think of, which is where fleas bite, are our ankles. So turns out they should have thought about that, but there is a little bit of a area where these doctors could still get infected. Moving on to Lyme's disease, or Lyme disease, excuse me, named from a town called Lyme, Connecticut, where the disease first emerged. This disease is caused by a bacteria called Borrelia burgdorferi. So it's actually written down here that I didn't realize I didn't put the genus here. So Borrelia is going to be transmitted to humans through a tick bite, and it's specifically Ixodes tick. They have complex life cycles, as you can see here, that involves different animals, but we're, accidentally transmitted to humans when the tick bites us. So we can see that the deer is a primary reservoir. The deer is going to be the sort of the definitive host. Remember, the definitive host is where we have sexual reproductions take place. And then the deer will release eggs into the environment. Then the eggs turn into a larva. They infect a mouse. When the mouse comes out, when the larva comes out of the mouse, you have this infected larva. So the mouse has this Borrelia inside of it. And then here's the infected tick. And then we're going to bite the person, and then we get passed on the Borrelia burgdorferi bacteria into our bodies. Or, of course, the deer is the normal host. So it needs, and also you can see it takes a couple years to reach maturity. So basically you find Lyme disease where you have a lot of human and deer contact, where there's a lot of deer populations. So this is going to be very much associated with the upper northwest of the United States, but not exclusively there. What Lyme disease looks like is a slow progressive disease that is going to mimic neuromuscular and rheumatoid arthritis. So a lot of the symptoms of this would be joint pain. There's 3 stages of Lyme disease. The first stage is the one that has this hallmark bullseye rash that everybody looks for in Lyme disease. So when you're bitten by the tick, wherever the tick bit you is going to form this bullseye rash. But you can see that it's not all the time. So 70 to 80% of the cases, you can see that, but there are cases where you don't have that characteristic rash. This rash is called erythema migrans. And if the rash is someplace you don't look very much, like you might have it on the scalp or any less visible location, you might miss it. So you're going to have malaise, headache, fever, and muscle stiffness. If you don't catch it in this early stage, then it can disseminate. So it goes into the body, right, via the bloodstream, and then you can have severe headaches. So it does affect the nervous system and the brain. Notice that we have on the late stages meningitis, encephalitis, altered mental states. So it does go into the central nervous system, a stiff neck. You can have some facial paralysis and then arthritis. The thing that called the attention to people in Lyme, Connecticut when this first came down was that a lot of young people were coming in with signs of arthritis. And so that was very uncommon, right? And so it prompted them to look into those diseases further. Late stages, you can have this for many years. And then that chronic inflammation that's in your body can cause really severe damage, as you can see, and it can be fatal. So Lyme disease is quite serious. There's a lot of research on Lyme disease right now in terms of like how to possibly like get rid of the ticks. So here's a little graph or like table on Lyme disease, reported cases and incidence of cases. And so we have Connecticut and California. So notice that Connecticut has a lot more than California, but California still has Lyme disease. So we need to be careful with ticks. This is our Borrelia. It is a spirochete. All right. So that's why it's drawn in this way. And this is the spirochete within the bloodstream. A little tidbit on tick management. So the tick, when it burrows into your skin, it wants to put its mouth parts into the, because it's eating your blood for a source of nutrition. And so you want to be really, really careful when you take a tick out, not to squeeze its abdomen, because if it's still connected to your skin and you squeeze its abdomen, you're going to push all that bacteria into your skin. So you want to make sure you don't squeeze the abdomen, make sure you have it on the small head, and then pull out with one swift movement vertically. And that's it we have for the bacteria. So we covered endocarditis, gas gangrene, Lyme disease, osteomyelitis. We covered the plague, toxic shock syndrome, and the one also caused by Streptococcus pyogenes. There's a lot of diseases here, and I'm just choosing the ones that are going to be something that you might see. Not that you might see the plague, but it is still around. So viral infections. Let's start part 2.